Hello everyone. Today I'm going to discuss odd ratio, relative risks, attributable risks, absolute risk reduction, number needed to treat, and number needed to harm. And these are important measures related to um, longitudinal study, for example, case control study and cohort study. Odd ratio. In case control study, we can measure odd ratio. Case control study starts with a group of case and a group of control. We are interested to know if the odds of a risk factor among cases are higher than controls. For example, if odds of having lung cancer are higher among cigarette smoker than odds of having lung cancer among non-smoker. Calculate odd ratio. To calculate the odd ratio, we need a 2 by 2 table. For example, here the there is a group of people who are suffering lung cancer and one group who are not suffering lung cancer. So before a case control study, we collected this sample data. So lung cancer cases and people who do not suffer lung cancer. And then we retrospectively investigate to find what are the relationship with the risk factor smoking. So how many people who are suffering lung cancer have smoking history and how many people who are not suffering lung cancer have smoking history. Similarly, how many people suffering lung cancer do not have any smoking history and people who are healthy and do not have a smoking history. From this 2 by 2 chart, we can easily calculate odd ratio. So odd ratio is basically we will calculate the odds of having lung cancer among smokers. So here we see the smokers and having lung cancer. This is the A, group A. And so we are going to take the lung cancer cases who have lung cancer and also have history of the smoking, which is A, divided by people who have lung cancer but are not smokers by C. That is the C. And that this is a ratio, so we are gonna divide that with people who do not have lung cancer but has a history of smoking divided by people who do not have lung cancer and do not have history of smoking. So from that cross multiplication, we will get the number 14. The odds of having history of smoking is 14 times greater for someone with lung cancer compared with someone without lung cancer. So odd ratio, basically in odd ratio, when the odd ratio is 1, that means there is no causal relationship. For example, there is no effect there is no effect of risk factor on the outcome. For example, if we take the gallbladder stone is the outcome or disease, and also we take a risk factor family history of gallbladder stone, and then we run a case control study with some sample data. If the odd ratio is 1, that means there is no association. And if the odd ratio is less than 1, that means the risk factor or the factor under study able to reduce the outcome of the disease. For example, if we are studying the factor which is influenza vaccine recipient, and also we are try to see the outcome, which is complication from the influenza. If the odd ratio is less than 1, that means that the risk of complication from influenza among the flu vaccine recipient is less than the people who didn't receive the flu vaccine. Similarly, the another aspect is if the odd ratio is more than one, means risk factor under study, for example, if it is smoking, increases the risk of disease outcome, lung cancer, than the group without the history of smoking. So, in our previous example, we saw the odd ratio was 14, where the people with lung cancer have history of the smoking. They are 14 times more likely suffering lung cancer than people who do not have um, lung cancer and do not have a that level of smoking. Relative breaks. Relative breaks. We can calculate relative breaks from cohort study. In cohort study, there are two groups, exposed and unexposed group. So, and it is a prospective study. We will look forward if the due to exposure to a particular risk factor, if what are the disease outcome among the exposed and unexposed group. So relative rates determine how much more likely exposed group will contract the disease compared with the unexposed group. So we can calculate relative risks by dividing the incidence rate of the exposed group by the incidence rate of the unexposed group. So the from this is also required 2 by 2 table. That would be helpful if we wanted to calculate relative risks. Here the cases of dermatitis and some people who do not have dermatitis, but in the cohort study we will have a group who are exposed, suppose the a group who exposed to arsenic and another group who doesn't who never exposed to arsenic. Okay, that's the risk factor, and we are looking forward to see who develop case of dermatitis. In that case, we need to know we are gonna calculate the incidence rate among the exposed group, and then divide that incidence divided that incidence rate with the incidence rate of unexposed group. For example, here, incidence rate among the arsenic exposure group, which is 80 cases out of 80 plus 260, that is that amount of cases, and divided by the cases among non-exposed group, which is again 80, but the number of total people in the non-exposed group is much higher. It's above 600, right? That is, if we do that, the ratio will bring the result of 2. That means relative risk 2 means exposed group has twice as much chance of contracting the disease as the unexposed group. So again, the next one is attributable risks. Attributable risks we can calculate from cohort study, and attributable risks indicate how many more cases in exposed group than unexposed group. Formula to calculate it is not division, it is a subtraction. So attributable risks is the incidence rate of exposed group minus incidence rate of unexposed group. So we are going to subtract this to from the last table. The data has been taken from the table 2 by 2 table in the last slide. And then attributable risks of this cohort study is zero point 0.1, or we can say 10% of the disease occurrence are due to exposure only. So the attributable risk basically tells us how many disease occurrences are only due to the exposure. Number needed to treat. Number needed to treat defined as number is the number of patients needed to treat to reduce one bad outcome. This bad outcome could be can be like death or disease. Number need to treat is reversal of the absolute risk reduction. So how we will calculate absolute risk reduction? The absolute risk reduction is the absolute difference in the rates of event between a treatment group relative to a control group who never received any treatment. So formula is event rate among non-treatment group or the control group minus event rate among treatment group. So we can say control group event rate CER minus experimental event rate of the treatment group event rate is the absolute risk reduction. So we can again use this 2 by 2 table to calculate the absolute risk reduction. In our calculation, absolute risk reduction is 0.1%. That is 1% difference between the difference in outcome between control group and treatment group. So the number need to treat is 1 divided by absolute reduction rate is 100. So we have to treat 100 people to reduce one disease outcome or the death or disease, whatever we are calculating. Next one is number needed to harm. Number needed to harm correspond to the number of individual who must be treated so that one individual presents an adverse reaction accountable to the treatment. This is the definition. Number needed to harm is the inverse of the attributable risks. So if we can calculate the attributable risks, as we did in the cohort study, attributable risks we have calculated in the previous slides, and then number needed to harm is just the reverse of that. So for example, 100 children were exposed to the risk factor as new medication or drug. 15 children suffered allergic reaction are attributable to this new drug itself. Okay, so number needed to treat would be 15. That's the 15 is the attributable risk divided by 1, which is 7. So every 7 children exposed to the new drug, 1 will develop allergic reaction. So that's the harm. That's all today's discussion. So hope you enjoy the discussion. Thank you.